Hi, I'm Dr. Kelly Starrett of the Ready State. I want to talk about how we integrate H-Wave OTC into the protocols, and more importantly, the surgical protocols of all the athletes and patients we work with. So remember, it's easy to get lost in the minutia and the complexity of the surgery. Hospital, surgical interventions, it's very, very, very complex. But on the ultimate side, or the end kind of result of this experience is we're trying to do a few things. And the number one goal is to restore motion and function back to the person, and specifically at a granular level, back to the motion segment or the tissue segment that we're trying to improve or that needs repair, surgical repair. So one of the ideas here then is that when we pan back out, there's really only a few things that we can try to really get done in rehab. In the initial site, the initial state, we are trying predominantly, or even less concerned about pain, which we'll talk about in a second, but we're really, really interested in seeing if we can decongest the surgical site. How are we going to evacuate swelling from the area? Not necessarily prevent it from swelling, but more importantly, evacuate the swelling, decongest the area, get the garbage out, groceries in, and get those tissues reperfused. So we need to get blood flow kind of honking back in there. Also, it's important to understand that we know to be in the experience of people post-surgically is that they have a lot of surgical inhibition or pain inhibition or swelling inhibition, which means we see the quads lag, we see the hamstrings not function very well. Around the back, we see sort of poor back musculature re-engagement, and that's a great system that your body sets up. That ultimately what ends up happening is that, hey, you've got a surgical site or an injury or an insult site to the body, and downregulating function in that is one of the ways to take forces out of the system, right? It's a little bit counterintuitive because ultimately we're trying to restore motion and function, but one of the ways that the body sort of self-circuits it is recognizing that, hey, if I have a site that can't generate force or take force or load, if we can decommission that site temporarily, it's better. But the problem is we get kind of late on the quad game, we get late on the reaction game. And so if we can keep that muscular system tied back into the brain earlier on, then we have much faster recovery times. In fact, we can actually get people healing at the actual speed of human physiology, which, believe it or not, is actually much more rare than you would think. So ultimately, when we pan back, we say, well, what are the tools available to us to help manage and decongest? What are the tools available to us to keep that musculature and the active tissues plugged back into the brain, and recognizing that these are neuromuscular muscle systems? Also, what we notice is that when we are able to manage that congestion, we have a lot less pain clinically in our athletes. So if this isn't always the case for 100% of the people, but when we make a concerted effort to really manage the congestion, manage the swelling after surgery, oftentimes our experience is that people have to take far fewer pain medications, if any pain medication at all. Oftentimes, clearly, there's surgical pain and surgical insight pain and recovery pain, but that's very different than the swelling and congestion pain that results from, that's a normal aspect of any surgical process. So ultimately, we're looking at, hey, how can I get movement back into the system, but I can't move because I have to protect these tissues. So one of the things that we love about using H-Wave is it allows us to get what we call movement without motion. So if I'm locked out, or if I, in this situation, have a leg surgery or knee surgery and I need to keep the limb immobilized, I can still getting movement in the musculature and the contractile tissues, which help to decongest, which help block or help the brain sort of not interpret the surgical site as going to be a threat, because we're getting movement in that, and we're able to maintain the integrity of that connection between musculature and brain. So specifically, when we use H-Wave OTC in our surgical patients, usually our experience is that we're using that beforehand. And the reason we're using it before is that we have a site that has undergone some trauma and needs help with decongestion, or in the situation that we also have, we have potential drug-free on-demand pain relief. We cannot stress enough the seriousness of using opiates to help manage pain, and it's a very, very powerful tool and appropriate, of course, in many situations. But if we have an alternative, we try to reach for that alternative first. So one of the things that we can do anytime we have a surgical site is that I put a pad on either side of the repaired joint. So if this was a hip, this would go on this hip and one on this hip. If it was an elbow, it'd go on one side of the elbow and the other side. If it was a shoulder, on one side and the other side. And what we're trying to do is actually put a little high frequency stimulation through the actual joint itself. So I have set here the H-Wave OTC onto high frequency, and then I just dial this up until I get a comfortable buzzing between and through the joint. So in short, if I have a surgical site anywhere in my body, I can put a pad on either side of that and dial up a little frequency. And what will end up happening is that my brain will not understand really what's happening down here, and I'll have a moment of reprieve. The high frequency stimulation through here is very comfortable and basically can give my brain or interrupt that signaling from joint or surgical repair site back up. And I can do this upwards of 45 minutes on, a couple hours off, 45 minutes on, and the reason we just need to give the skin a little break. So giving someone the tool to be able to manage post-surgical pain drug-free oftentimes is enough to help that person feel like they have some agency and control. If the pain gets really bad, we know we can dial that up and for 45 minutes pretty much shut that pain signal down, which is really, really important. Later on, it becomes important because then I may be able to get some motion or do my rehab in a pain-free state, but at the very least, it may mean that I may be able to get some hours of sleep because I'm not being flooded or being threatened by the signaling coming from the repaired site. Most importantly, though, what we know is that if you are an active person or a typical person in the day, we would like you to be getting 12,000 steps a day. That 12 to 15,000 is our sort of healthy person goal to try to get the tissues decongested and loaded. And so one of the nice aspects of having this low frequency opportunity here is that we can dial this up and get some pretty significant quad contraction going in the system. And I just move the pads around until I get a little bit of a contraction here. But the idea is that if once I can start to get some significant quad contraction in, what ends up happening now is I'm now decongesting that tissue, of course. And so what we know is, hey, what are the mechanisms by which I'm going to remove that swelling? Well, certainly icing will not do it. Icing is about pain control only, but the mechanism is either going to be some kind of gravity, get my foot really up, some kind of compression, or I can let my muscle tissues do the job that they're designed to do. Remember that lymphatic system, muscular system go together on purpose. And so the idea of being able to decongest, which means I gotta have muscle contraction, but if I can't load, I have to protect, can't bend the limb, then my movement options are less. So one of the things that we get here is that we get what we call, again, movement without motion, which allows me to decongest. Now, important here and crucial to this understanding is that the tissues have to undergo some low-level loading in order for that scar tissue to align itself as normal tissues. This comes down to this fundamental concept called mechanotransduction. If I need my tendon or ligament or soft tissue or muscle to behave like a ligament, tendon, soft tissue or muscle, then I'm going to need mechanical input through those tissues at the cellular level for them to express themselves. So one of the things that we get out of here is that I'll see less scarring involved because, or less disorganized scarring involved because the gentle pulling through those tissue systems start to help to realign the surgical repaired fibers. And so what we end up having is a much more coherent model. What we know again is that swollen, congested tissues don't heal, they don't have a lot of blood flow. We get the neurologic sort of implications of all of this congestion. And if you're going to stay ahead of the traditional timelines, which are very, very low and very, very sort of organized around the lowest common denominator of a person who is icing and not moving, what we realize is that we can get further ahead, get people returned back to field of play, return back to their roles in society, return back in their roles of teams, if we can get them healing at the rate that humans can heal, which means that managing pain and managing congestion and getting these tissues turned back on is the game. So again, we use the H-Wave OTC to help manage pain on demand. We also help use it to manage the congestion in pre-surgical sites and post-surgical sites. And here at the Ready State, every single one of the surgical protocols or rehab protocols that we use, we recommend one of these for our patients and athletes.